All right, so you should have watched the video on CPR. Now I'm going to go into how to use the AED, as well as how to do CPR, how to modify what we just learned to do it on a child and a baby. So this is Frank. Frank has collapsed. I walked into the room. I followed all of RabCat. Okay. I am currently doing CPR while Sheila over here has brought me now the AED. Ideally, I will keep doing CPR while someone else is putting the AED and we're working around each other so that I'm still doing CPR. However, I'm by myself. I do not think Sheila will be able to help me with this. So what I'm going to do is I'm going to go through and follow the steps of the AED. It tells you exactly what to do, so we're just going to listen to it and follow the steps. So all the AEDs look like this. This is the exact same type of our AED, but this is a trainer. They are normally in red cases with a little pouch that looks similar to this. In this little pouch is a razor, an alcohol pad, a scissors, and a face mask and gloves, okay? So let's open this guy up and do what we need to do. Really, the only step of using an AED is turning it on. There are two ways for us to turn this one on, using the green button or pulling it. So I'm just going to pull it.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
You're always going to put the AED on the side closest to you. If I needed to cut the clothes.
When patient's chest is bare, remove protective cover and take out white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
So it's going to go on the upper right chest. I'm going to push it onto their skin.
When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture.
And the second one is going to go
to patient's bare skin.
bottom left abdomen area. Okay.
When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner.
But I already did it.
Exactly as
So
shown
why is it
in the
asking me to do
picture.
that? The reason why it's
firmly to patient's bare skin.
The reason why it's asking me to do that is because it's not in contact enough. So I should push it down again. I should be trying to compress it. I should make sure it's there. For this to activate right now, I am going to put my hands on it, but I would never normally do that. Actually, pause. I'm going to go see if I can find the thing that'll make it activate. Pause. Okay. So you're going to pretend that this silver thing is not there. Okay, this is part of his body. It's telling me to put the pads exactly as they're shown. Oh.
No one should touch the patient.
Watch your knees.
Analyzing. No one should touch the patient. Shock advised. Stay clear of patient. Press the flashing orange button now.
Okay, so I make sure no one was touching the patient. I'm going to say clear, and I'm going to press the yellow button. They're going to get shocked.
Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
All right, I'm going to stop. So it told me what I needed to do. I stopped counting out loud because it started counting for me. Okay? So I didn't need to be counting because the machine was counting for me. If you notice in the beginning, it took a little bit. So it was like cut the pads from, or cut the patient's clothing. Look at the pads. So it takes a little bit. If you know the next steps, you're just gonna go and do the next steps, okay? And remember, when possible, I'm gonna use a breathing device. I'm gonna use PPE. I'm gonna have my gloves and I'm gonna have my face mask. AED is super important. Every minute you don't use it is a 10% chance that they're going to not survive, okay? So after 10 minutes, there's very little like statistically success rate with it, okay? If you noticed, I shocked and then I kept doing CPR, okay? One, it's not gonna be like them shocking like they are in the movies, okay? It's going to be a little jolt probably, and then if they don't wake up, you keep doing CPR. The AED will only shock someone if there's an electrical impulse that is incorrect. If there is no impulse, it will not shock. So what I'm doing with the compressions, every time I'm compressing, I'm physically pushing the heart down. And that's why you have to go so far down, because I'm pushing all of the blood out of the heart to get the blood circulating throughout the body. And then I'm doing my breaths. When I do my breaths, my blood or my oxygen is going to go into the lungs. It's then going to oxygenate the blood. Then I'm going to go back and I'm going to do my compressions. When I'm doing my compressions, I'm pushing the blood that is now oxygenated out of the heart and into the body. Your blood already has oxygen in it. So if you can't do breaths, it's okay because it still has a percentage of oxygen. The other thing about compressions that is really important is that I let the chest recoil when I do it. So I can't just like stay here at the bottom. I have to go all the way up and let that chest come back. If I stay here at the bottom, I push all the blood out of the heart, but it's not filling up like it would in a normal compression. Then I'm going to do CPR for 5 cycles or 2 minutes, just like we talked about with when you switched with your partner. It's the same thing, 5 cycles, 2 minutes. The AED will reanalyze again. It'll do it on its own. It'll say, analyzing, you'll back off again. It'll do it for you. If you don't want the thing telling you about CPR, you can turn that off. And you can just do it, and then every 2 minutes, it'll still instinctively analyze. You're trying to push on the heart to get it to contract a little bit. Remember, think about in like Grey's Anatomy, when they do a heart replacement and they're like, come on, buddy, start beating, and they start like massaging the heart. That's what we're doing. We're massaging the heart just with their own ribs, okay? Anything else I want to tell you about that? I don't think there's anything else I want to tell you about that. Some things to think about with the AED. One, they can't be really hairy. If they're hairy, you're going to shave them. There is a razor in it, in the little package. You're going to shave them. If they're wet, you want to try to dry off where the pads are going. You don't need to dry off their whole body. It's okay if there's some water around them. But it basically, rule of thumb, if you'd step in, there'd be a puddle or a splash. That's too deep. Move them. Don't do it on the metal bleachers. Okay, so no metal bleachers, not in like submerged in water. Dry it the best you can. Other things to think about is if they have a pacemaker. If they have a pacemaker, you are actually going to move it around their pacemaker. Normally, you'll know they have a pacemaker because it's a big bulge. So you'll just move it a little bit. Okay. If they have a medication patch, they have birth control, they have nicotine patch, they have nitroglycerin for strokes, whatever it is. You are going to remove that medicine patch. You're going to use the alcohol pad to wipe it down, and then you are going to put the AED pads on. You do not need to remove belly button rings or earrings or anything like that. They have some big metal thing on them that would interfere with this maybe, but for the most part, you're okay. You also are going to cut as much as you need to. So like for the most part, I could probably leave someone's sports bra on, but if I needed to, I'm going to take it off. Their life is more important. I will try to be as modest as possible. I will try to shade the area or like make it to where like the fans and everyone can't see. Like if we were doing CPR, we'd like escort everyone out of the area as soon as possible so that we can kind of give them some dignity in what's happening. Use the AED all the time, as soon as possible. As soon as possible. Okay, you want to put it on as soon as possible. Now I'm gonna get rid of this man. We saved Frank. He's working out. Frank survived. So we're gonna move him away. Now I'm gonna bring in my baby or child. This is my child. Okay, these ones are new. We just got new childs and new babies. So we haven't named him yet, but we're gonna say that this is our child. Okay, children are going to have a little bit of differences with their CPR. Instead of 2 hands like an adult, you're actually just going to do 1 hand, okay? Instead of 2 to 2.4 inches down, I'm going to go 2 inches down, okay? So 2 inches down with 1 hand. If I'm not strong enough or I'm getting too tired, I can go 2 hands again. But you really, for the most part, only need 1. How do I know they're a child versus an infant? Or a child versus an adult? Is any signs of puberty, they are an adult. So everyone in high school, pretty much you're an adult, okay? Any signs of puberty, hair, breasts, facial hair, anything that is a sign of puberty, we're gonna treat them like an adult. If not, they're gonna be a child, okay? So that's one of the differences, is that you're gonna do compressions with 1 hand. You're still gonna do a head tilt chin lift. You're just not gonna have to breathe as much because their lungs aren't as big. So as soon as you see that chest rise, you stop, okay? 30 compressions, 2 breaths. Easy peasy, same thing. It's never gonna change, 30 to 2. Now, I have my baby. Again, this is a new baby, so it doesn't have a name. Our other baby is named Nigel, okay? So this is our baby that we have right now. For a baby, you can put it on a surface, or you can hold it, and you're going to be doing 2 fingers, okay? So in a baby, his legs like dislocate. In a baby, you are doing 1.5 inches, okay? So 1.5 to 2 inches. Okay, you can see it. It looks a little bit more drastic on this little baby. Okay, 1.5 to 2 inches. I'm using 2 fingers, or I'm using 2 fingers like in the knuckle position. Okay, if I have to, again, I could use my hand, but you probably only need 2 fingers. What I want you to think about is the baby. His chest is a little bit higher than where an adult and child are. So like if you go here, you're hitting that xiphoid process. So you want to go basically between the shoulder line of a baby. And you can open him up. You can see like this guy has a little belly button. He has little nipples. You're gonna go right there, okay? So, but I often see you go too low on a baby. But we're gonna do our compressions, okay? The other difference with a baby is you are not going to pinch their nose. Their nose is too small. So you are just gonna put your mouth over their nose and their mouth. But I also want you to think like a baby's neck and its trachea is a little bit smaller than an adult and child. So think of like a straw. If you put a straw too far forward, you're not gonna be able to drink. If you put a straw too far back, you're not gonna be able to drink. So think of it like that. So I wanna tilt the baby's head back, but I don't wanna go all the way back. You know, like babies have really soft necks. They don't really have all of their skeletal system fully formed yet. So I'm just gonna put it a little bit back. And then I'm gonna put my mouth over their nose and their mouth. And I have to barely breathe for it to go up. Okay, so just stop as soon as you get it. It's always 30 and 2. Yeah. Okay, there's also 2 more differences with childs and babies. I'm just gonna address them real quick. 2 more differences for childs and baby. How do you know it's a baby? Basically like signs of walking, they're a child. Infants are normally like infant to 2 years old. The AED. Okay, so with an AED, there are children pads. If there are not children pads, you're just gonna put it on, but you have to know the pads can't touch each other. So if I were to put those big pads on this baby in the position I'm supposed to, on the right chest and the left abdomen, they would touch. So instead of that, I'm gonna put 1 on the front and 1 on the back. And same thing for the child. If the child's not big enough, I'm gonna put 1 on the front and 1 on the back. All right. We're gonna do a separate video on choking. And other than that, I think you guys are ready to do CPR. Oh, wait, I have 1 more difference. Sorry. The other difference with child and infants is that if you go out onto a field or you go to the park and there's a random baby by itself, not breathing and unconscious. As an adult, you are normally gonna go into cardiac arrest or your heart's gonna stop for reasons such as you have high cholesterol, you have made bad decisions, maybe you're doing drugs and alcohol or something like is wrong with your body, right? Or you're having a blockage. As an adult, it's normally a physical abnormality or something actually happening. A child and a baby, for the most part, are gonna be going unconscious or needing CPR because they stop breathing. So, you know how if I told you you were by yourself, you'd go get the AED right away with an adult? With our babies and our children, you're not going to do that right away. Instead, you're going to do 2 minutes or 5 cycles of CPR if you're by yourself, and then go get the AED, okay? So the reason being is because we think it is a breathing problem. So instead of doing, instead of like them not really going to be able to be woken up without an AED, if you do just compressions and breaths, the baby and the child may wake up more often. So it is definitely more likelihood that they will wake up if you start early CPR. So you do 2 minutes or 5 cycles, then you go get the AED and call 911. All right, I think that's it.
Bye.